Hey everybody, my name's Dr. Scott Giacomucci. I'm a trauma therapist and educator in Pennsylvania. And today I wanted to talk about the connection between trauma and loss. So trauma and loss really go hand in hand. In every experience of trauma, there's also an experience of loss. And there's no way around that. That loss is really at the heart of every memory, every experience of trauma. Whether that's the loss of a person, someone dying, or the loss of a relationship, or feeling like we've lost a part of ourselves, or in many experiences of trauma, what is lost is a sense of trust or a sense of hope, or a sense of innocence or faith. And so on some level, every time we experience trauma, there's also an experience of loss within that. It's kind of like a double whammy. Now, of course, there are certain specific types of loss that are traumatic as well. And we simply call that traumatic loss. So traumatic loss is when we experience a death that is traumatic in nature. And these are the types of losses and deaths that are usually sudden, they're usually unexpected. Sometimes these are violent losses, or when we lose someone to a medical condition or an overdose or suicide. These would all be considered traumatic losses. So on one hand, there's an experience of loss in every experience of trauma. And on the other hand, there's also a type of loss called traumatic loss, when the trauma or the loss is also traumatic. And what I found with working with traumatic loss is, first of all, that it's quite common. I work mostly with folks who are either in recovery from some sort of addiction or substance use, or folks that have experienced trauma, and especially complex trauma. And traumatic loss is particularly common with the folks I'm working with. I think the COVID-19 pandemic really ratcheted up the likelihood of all of us experiencing traumatic loss, and that it was already pretty common before the pandemic. And traumatic loss leads to traumatic grief. And this is when our natural grieving process really gets impacted, when sometimes disrupted, because we're dealing with a trauma that's on top of the loss. And what tends to happen is the disturbing images, the flashbacks, the nightmares, the distorted negative beliefs about the trauma, the avoidance and numbing and dissociation, the reactivity and hyperarousal. These are the PTSD symptoms, that these can really disrupt our ability to grieve naturally and normally. And what I found over the years working with traumatic loss is that most of the time we've got to deal with the trauma aspect of the traumatic loss before we're able to get into the grief in a normal and natural and healthy way. That the traumatic stress from the traumatic loss really prevents somebody from grieving in a simple way. So if you're struggling with traumatic loss, I would really encourage you to seek out and find someone who specializes in trauma that could help you work through the traumatic stress related to the traumatic loss. And chances are, after working through that element of the traumatic loss, that the grieving part will be a little bit easier. It's never going to be completely easy, because traumatic loss and death are never easy. They're tough. But if you're not struggling with the traumatic stress, then grieving is going to be a lot more natural and simple. So beyond traumatic loss, I want to come back to the experience of trauma and of traumatic stress and post-traumatic stress disorder and complex post-traumatic stress disorder. If you wanted to learn more about those two diagnoses, I'd encourage you to check out some of the other videos on the channel here. But I did want to highlight how the lived experience of struggling with or experiencing any form of traumatic stress also leads to further loss. And it's almost like there's a cycle here, that the trauma involves an experience of loss, leads to traumatic stress, and then the traumatic stress leads to additional loss, in that by experiencing CPTSD and PTSD symptoms, we further start to lose a sense of trust in our body, a sense of trust in our nervous system. We start to lose trust in ourselves and in our brain and in our mind. We can lose trust in other people and in the world. The losses that come with PTSD and CPTSD are just compounded on top of the loss that was experienced at the time of the trauma. And so trauma can really lead to us losing some of our core beliefs about the world. Many people in the aftermath of trauma can no longer hold on to this core belief that the world is safe, or that people can be trusted, or that there's goodness within every person. These are fundamental beliefs that many people grow up learning or believing. And after experiencing trauma, and particularly trauma throughout one's childhood, we might lose some of these beliefs. And these beliefs might start to get replaced with other beliefs, negative beliefs, that the world is not safe, that nobody can be trusted, and so on and so on. So there really can be a loss on a cognitive level in terms of the beliefs and the fundamental ways that we experience and perceive and think about the world and ourselves. Another type of loss that I feel like doesn't get talked about enough when it comes to trauma is the loss of what could have been. That when we experience trauma, there's often a grieving process and a real sense of loss on what if that trauma never happened and I never had to go through this? My life would have been so much different. What if I did have a parent that loved me and didn't hurt me and didn't neglect me? There's a whole different life I would have had. And in realizing that, there's a real loss that comes with it. What if I didn't struggle with PTSD or complex PTSD? How would the trajectory of my life have gone in a different direction had I never had to struggle with trauma or post-traumatic stress? And so I really want to emphasize that there's a really normal, natural, and even expected grieving process that comes with that. Sometimes it happens on its own. Sometimes it happens in trauma therapy. When we start to work on the trauma, we might come to realize what we've lost because of the trauma, but there tends to be some sort of grieving process around this. And so in all of this, I think it's important to emphasize that the opposite of loss is connection. And so if trauma involves an experience of loss, every experience of trauma involves an experience of loss, then it makes sense that the opposite, connection, would be important in trauma recovery and in trauma therapy. And that grief is a natural, normal part of the trauma recovery process. So I really want to emphasize the importance of relationships here at the end of the video, that relationships, finding and building attachments and connections and groups and community and solidarity, peer support with folks that you can trust, whether those are professionals or other trauma survivors or colleagues or friends or family members, that this is a really key ingredient in trauma recovery and trauma therapy for anyone and everyone who's on this journey of trying to heal and grow from trauma, post-traumatic stress, or complex PTSD. So I hope you found this video useful. If you did, I encourage you to subscribe to our channel and like the video here. Leave a comment about something you learned in the video or something you feel like I forgot to mention in the video. And check out some of the other videos. My hope is that this series of videos will be useful both for trauma therapists and folks who are in training to help people heal from trauma. But also, I hope these videos are useful for anyone that's struggling with trauma or struggling with PTSD.